Welcome everyone to the presentation, Strengthening Public Health Preparedness with GIS. I am Anna Verrill, a Senior GIS Analyst with CGIA, and I will be the moderator for today. And with me today is Kimberly Few. Kimberly has worked for over 20 years in the field of emergency preparedness and human services. She is a registered member of the Speakers Bureau for the Red Cross of Southern California, as well as a previous board member for multiple chapters of the Association of Contingency Planners International. She has also served as a volunteer consultant for the National Emergency Management Association and the International Association of Emergency Managers, and is an Infrared Guard member. So just a couple notes. To join the chat, please click the join chat button, and throughout the presentation, you can enter your comments or questions in there, and we will get to those at the end of the session. And the session is being recorded and will be provided on our YouTube channel following the conference. And with that, I will hand it over to you, Kimberly.
Excellent, thank you. Well, welcome to my talk today about strengthening public health preparedness with GIS. I hope it gives you a few new ideas to add to the great work you are already doing. As we head into 2021, it's already been an interesting year. There are a lot of threats and they're getting more and more expensive. NOAA creates an annual report of the complex billion-dollar events facing our nation, and this map shows the cumulative costs of the largest disasters from weather and climate over 40 years. All in all, climate disasters alone have cost this country over $1.6 trillion, not to mention countless lives lost and damaged, some irreparably. These disasters have stressed our systems and our community resilience in many ways. And while we do better than many countries around the world in our ability to respond, I think we know we're not there yet. We're not nearly as ready as we could be or as ready as we need to be. I think we can see that happening in our country right now, this very minute. Just think about the health-related emergencies we faced last year alone. We've seen weather and climate-related disasters like wildfires, hurricanes, floods, toxic material explosions, and of course, overriding all of that is COVID-19. We will soon be adding on to the pandemic the dual disasters of increased homelessness, poverty, addiction, domestic violence, and mental health issues. We simply can't live like this anymore, using binders on bookshelves and legacy systems that don't accomplish what we need from them. It's critical to enable our mobile workforce and make their lives easier. By doing that, we can start to overcome our lack of real-time insight. And as we have learned from the pandemic, there's no need to wait for people to come back to headquarters with their reports to be manually entered into data systems. Besides, there are so many stakeholders involved in any kind of response that it's hard to keep track. With all of this increasing complexity, we need better answers and better technology. This is a screenshot of the Johns Hopkins dashboard that I took on January 25th of last year. We had 555 confirmed cases, 17 total dead. And we were already within Esri looking and saying, this is something we need to keep an eye on. This was taken last week on February 10th. We're closing in on 2.5 million deaths globally. We've seen a new emergence of technology in tracking something like a pandemic on a global scale, and the constant need to visualize and understand really complex data. As we watch the red dots of positive COVID cases track across the globe, we could see in real time how the spread was happening and begin to try to do something to stop it. Applying a geographic lens to data can really help gain understanding. That geographic lens has been important to our understanding of health outcomes since at least 400 BC, when Hippocrates wrote about the subject. But it's really only been about the last decade in which the technology has been ready for anyone to make sense of complex environments very quickly and easily. And it's even more recent that people have had the ability to start working in real-time environments to keep pace with the rapid-fire needs of stakeholders during an event. Now, you may not have realized that a GIS is more than a mapping system. A GIS provides a framework and a process for creating and applying geographic knowledge. When you understand these basic categories of what a GIS can do, you can apply it to more effectively to your workflow. In a nutshell, a GIS allows us to collect and manage data, analyze and visualize it so we can understand situations more clearly. And it's a technology that helps us to work in collaborative ways, make better decisions, and then put priorities into action. When looking at how a GIS can work within public health emergency preparedness, we start with the CDC 6 domains of preparedness and associate a number of workflows and templates with each of those domains. So to start off, we address community resilience, which is all about preparing for and recovering from emergencies. A starting point for doing that might be in modeling and predicting what kind of event is most likely to happen in your community. You'll then want to identify your assets, that critical infrastructure like health facilities and community resources that can either be impacted or leveraged in the event of an emergency. And of course, being resilient requires an understanding of the populations you serve, their vulnerabilities and special needs so that they have the best possible chance of a quick recovery from any event. This COVID risk map is from the Columbia University Epidemiology Department, and it shows how you can use GIS to bring in multiple layers or feeds and use different risk analysis models to predict where COVID-19 will have the high case counts and then the highest impacts on the healthcare system. One of the most common projects we've seen our public health customers work on is a rapid health needs assessment. It's based on the CDC CASPR model, which is designed to provide public health leaders and emergency managers information about a community so they can make informed decisions. It uses a valid sampling methodology to collect information at the household level and can be used in disaster or non-disaster settings. By incorporating GIS into the process, agencies are able to reduce the complexity because the system does the sampling for them, reduce time. One large city agency told me they saved almost a month of full-time work by implementing the GIS process and thereby reduce cost overall. When the city of Austin, Texas conducted their first rapid health needs assessment, they saved hours of time by implementing random samplings and determining clusters using GIS. Their previous manual sampling selection was labor intensive and difficult. And they're also able to have live updates from the field using mobile devices and visualize the entire progress in dashboards that are capturing those feeds in real time. Looking at incident management, which is the next step, the idea here is to develop that common operating picture, having all of your data in one place that you can share with the right people, whether decision makers, team members, stakeholders, or the public. A good tool to use with incident management is technology in the field. It feeds directly back to your operations center in live feeds and dashboards. A situation awareness viewer, for example, can be used to outline the scope of a disaster, identify entities that would be affected by the disaster, such as schools, hospitals, special needs community members, and key things like road closures, bridges out, and flooded areas that would block your evacuation efforts. In Sonoma County during the California wildfires, hospitals had to be evacuated and their patients sent to different facilities literally as the fire was closing in on them. The county was able to create maps of all active wildfires, build dashboards that were absorbing data directly from the field via mobile apps, and determine how they could most safely plan routes to get the evacuated patients to new facilities that were outside the fire line. With live weather feeds and a Waze integration, that up-to-the-minute data helped tremendously in making critical decisions and ensuring the safety of everyone involved. Now let's move on to information management. Data is key in an emergency. We often need lots of different kinds of data to support our work, but it can be a real challenge to get disparate data sources to work together quickly. Sometimes geography can provide that consistent element that allows data sets to be integrated and therefore more effective in conducting analysis and answering questions. And when events evolve, we need real-time data to enhance our decision-making. Ultimately, what you really need is for all of your data to be ready to use in one reliable place. Your GIS can bring in all kinds of data as illustrated above and mentioned in the last case study. With the ability to join together your own data with live feeds, tabular and spatial data, and imagery, you can bring this all together in a very unique way to enable critical decisions to be made. The content that a GIS can absorb and work with is almost limitless and can then be shared across agencies. That content can then be displayed in multiple ways, such as the swipe map on the bottom left of before and after aerial views of flooding after Hurricane Harvey in Texas, or live feeds of a hurricane path on the top right during Hurricane Maria. Then you have the total number of state troopers on duty in an area of Oklahoma on display. So dispatch can send the closest one to an incident, or at the bottom right, an overview of bringing together multiple department feeds into one dashboard site, so monitoring all of the different entities is easier to do. The next domain to consider is countermeasures and mitigation. In any event, it's important to safeguard and distribute medicines and supplies before, during, and after. But where should the medicines be delivered and stored? Where's the greatest need? We know that health needs vary widely from one place to another, so getting a good understanding of where resources will be required improves decision making. And it's the responsibility of any activated organization to protect the health and safety of their field staff, volunteers, and then that capability often requires more real-time data. And this is a look at formulating distribution options for COVID vaccinations, knowing where facilities are and where the phased populations are located. Once you have those two pieces of information, you can begin to assess for gaps in access to vaccine and start to do something about it. You might cite new points of dispensing using a process we call location allocation that will help you ensure that new sites serve the greatest needs based on your key criteria. One tool to use is the CDC Social Vulnerability Index, which combines 15 measures of vulnerability across 4 life domains. You might also examine other potential solutions for outreach, like mobile vaccination teams that can vaccinate hard to reach populations, like tribes or people experiencing homelessness. And this is just a simple overview of the location allocation workflow where you load all of your candidate vaccination venues, overlay your highest risk populations, like those who are highly exposed to virus in their jobs, or those that can become severely ill due to medical comorbidities. Then you might add some access criteria, like a 30-minute drive time or a 15-minute walk time, and this system will calculate the most optimal sites for you. Direct Relief is an organization that provides assistance all over the world after disasters, delivering needed equipment and resources. Here's a case study they performed to try to determine the migration of residents of the burn areas in California, specifically from the Camp Fire in Paradise. And once they saw that the crisis had forced a population change in a particular area, the town was virtually unlivable, they chose the spot where people had gone to as their new service area and set up a mobile assistance unit there to hand out inhalers and other necessary equipment. Sometimes an event requires an expansion of medical services or health resources within a community. When there's a surge, location is a key aspect of planning and monitoring these services to ensure needs are met. Mapping can help identify geographic gaps in resources and intelligently target new partners to recruit. And when the emergency happens, citizens need to know what services are available to them and where to find them. We know that there are a number of healthcare facilities that commonly deliver vaccines of various kinds throughout the year, such as hospitals, clinics, and pharmacies, to name a few. However, in consideration of the current COVID-19 vaccine candidates, there may be additional criteria like ultra cold storage requirements that will limit which facilities can store and administer which vaccine. Further, when we think about a facility's capacity to deliver the vaccine, we might want to examine and understand factors such as access logistics, like ingress and egress for drive-through vaccination clinics or parking, facility size, and nearby traffic conditions. We'll also want to identify additional vaccine venue candidates for later distribution phases when we expect a larger surge, when both supply and demand increase dramatically. And at that time, we might want to include work sites, senior centers, and retail settings as new candidates, for example. Once a location is chosen, you can then do a drive time analysis around it to learn more about the population it would be serving, getting a deeper view into such things as median household income, race, employment, and even such details as what types of health insurance people have and where they get their entertainment, like which radio stations they listen to or where they like to go to eat. This can help inform how you extend outreach to those communities and let them know about the services that you're offering. One example took place in Pinellas County, Florida during Hurricane Irma. They traditionally announce evacuation zones by zone, but quickly realized that a vast majority of residents that normally aren't evacuated, like those in the inland areas, have absolutely no idea which zone they live in. So they built a map application where you could enter your address and determine your zone. And on September 9th, 2017, that map had over 28 million requests in one day. When building these things out, you also have to ensure that they're scalable to handle that kind of traffic. That was an incredibly successful project for them. I really love talking about the domain of biosurveillance. And this is where I think a lot of our epidemiologists and public health professionals really feel very comfortable. Recognizing patterns in data, especially patterns that emerge over space and time, is central to modeling, predicting, detecting, or following evolving events. The resulting authoritative information then needs to be available to all appropriate stakeholders in a way that's easy to understand and interpret. A good example of biosurveillance touches on the work we've done on the COVID-19 pandemic since it began, throughout each phase, with public and private health agencies to help them understand what is happening in real time. We've released templates and solutions to anyone who requested them across the world since January. And many of the items we've worked with for this pandemic response go well beyond basic mapping, dealing with predictive analysis. It's always hard to say, identifying vulnerabilities in the population, distribution planning, risk assessments, and data and dashboards to assist in real-time decision making. This dashboard from the state of Georgia helps the state public health agency keep an eye on the hospital bed and ventilator availability across the state. This will assist in allocating resources as the pandemic progresses. In this county trends map, take a look at where the areas are in the country that are trending with higher numbers of new cases or lower based on color. The darker the color in this map, the worse off the county is. It's a quick and easy way to really see where the country stands in one view. You can bring all types of data together in your GIS to help with your preparedness planning and response, even adding social media, crowdsourcing, live weather, electronic medical records, mortality reports to create a fully interactive live experience in your operations center. There's just so many different types of data that you can bring in to assist. This is the state of Arizona governor's dashboard, which contains information on all emergency support functions or ESFs that the governor's response agencies must monitor. It changes daily based on what's going on in the state and contains live feeds on things like weather, mass care, COVID cases, hazmat incidents, any and all hazards that could affect the residents of Arizona. Having it all in one place has made it a critical tool for the governor internally, as well as an excellent communication tool for his constituents. It's publicly available, but it's also something he refers to every morning. And they even do things like hide trivia questions and answers throughout the dashboard to make sure that everyone's looking at it. And one last example of great biosurveillance from the city of Tempe, Arizona. They're using a dashboard to monitor EMS calls for service for opioid overdoses. So they have a good idea of where their opioid epidemic from above the ground, while they're also using wastewater collection to monitor the amount of opioids in the wastewater below the ground, which allows them to pinpoint down to the block level where they might be having issues with overdoses in the future. And that's a project that we've been watching closely. It's just very interesting. So to wrap up all of what I've said, bringing location intelligence into your efforts will transform your public health preparedness plans, helping you to rapidly discover, visualize, analyze, and share critical information across your organization and with your partners, making you more agile in the face of evolving threats. We have a few resources available to you. I'm happy to share out. There's a white paper that goes into more detail on applying GIS to public health preparedness, a story map with linked examples and resources, and a link to solutions to explore many of the application templates shown today. And then there's also the ESRI Disaster Response Program. If you find your organization unprepared during an event, we can help, but it's always better to establish those capabilities now. We actually give out free services, free software, anything that you need in the case of a disaster. And I can tell you right now, we have many, many requests coming out from across the South and the East. So we're always there to help. Well, thank you for your time today. I know that was a lot of content that I went through pretty quickly. Do we have any questions?
Great, thank you, Kimberly. I've been monitoring the chat and there's no questions as of yet, so I will repeat. If you'd like to enter the chat, you do have to click the button join chat, and then you can enter in anything in that chat feed. That was a really good presentation. It's interesting how much GIS can be applied across all various sectors, and how it's been implemented since the beginning of this pandemic is just amazing.
Yes,
We
it's been a lot.
Prior to, a lot of people, what do you do for GIS? Oh, I make maps. What is GIS? And I just boil it down to, oh, I make maps. I work with spatial data. And then their eyes just kind of glaze over.
Exactly.
But
This has
now,
changed that.
yeah, now with that John Hopkins map, we can point to it and be like, that's what we do. Okay, so Jean Hannon says, such a good idea. Meredith says, great, thank you. Sue says, do you reach out to states or do they reach out to you?
Both. Absolutely both. So I would say that on a daily basis, we are very interactive with the state. We work with all of the states to various levels. I would say that especially within the health departments, it's not consistent how they're using us for specifically emergency preparedness. Their emergency management departments, absolutely. But looking at GIS and getting that more into the health departments, I think is something newer. Like I showed the binders on the shelf at the beginning of the presentation, a lot of our health departments still live in those binders. And so we are constantly trying to reach out and help them. But during disaster times, we get a lot of outreach as well from them.
Great. Thank you. Nothing else so far has come through.
Well, my contact information is on that slide. I'm always available to send you more information or assist in any way that we can. And this is being recorded as well, so it will be available to people, right?
Yes, that's true.
Great.
Well, with that and no other questions or comments coming through, I think we're okay to end a little early prior to the closing remarks. We do have one more comment. Jack Drost is asking if the presentation is available somehow.
Oh, yes, I'd be happy to. Should I send that to you as a PDF and it can be distributed?
Yeah, that'd be perfect.
Sure.
I know Jack, so I can email it to him.
Okay.
I will actually email you so you can have my email.
Perfect. Yeah, very good.
So I just want to remind everybody to be sure to tune into the closing remarks after the session. Those begin at 1. And don't forget to fill out your conference survey. Again, Kimberly, thank you for your presentation and your time this afternoon. Greatly appreciate it.